Trying to see how to.
Hi. Okay, we've been having some technical difficulties, so this is going to be in the blooper reel. So welcome back. Today is Tuesday. This is going to be our first Your Health, and we have some new things that we are going to do with this program that we thought would be exciting and fun for everyone. So one of my best friends is actually joining us. If you are on Instagram, you can't see her face, but if you're on everything else like Facebook or YouTube, you can see her. So this is Dr. Cordia Clark-White. I am Dr. Tony Scott Terry, and we're going to tell you both about where our practices are located, and we are both obstetrician gynecologists. So this is going to be topics about basically your health, and that's going to include women and men. So I'll let Dr. Clark-White start so she can introduce herself and tell you where she's located and whatever else she wants to tell you.
Hi, everyone. I'm Dr. Clark-White. I'm very excited to be here. As Dr. Scott Terry said, we're best friends. We've actually been friends since 5th grade. I'm an OBGYN, and I'm located in the South Loop area. My office is on 19th and Wabash. I am CEO and owner of Women's Progressive Healthcare, and we're here for women's health, and we're excited to be doing this with my best friend, Dr. Scott Terry.
Thank you, Dr. Clark-White. and for those of you who don't know, my medical office is actually located at 20325 Graceland Lane, and that's in Frankfort, Illinois, but soon to be at 7151 West 183rd Street, which is right across the street from the spa. So we're joining the office and the spa all in one location. So for the next several months, and however long we continue to do it, we are going to be sometimes in separate places, sometimes sitting together with mimosas, or depends on what time of day it is.
And how many bloopers we have.
And how many bloopers, because we will have bloopers. but we are going to be doing these broadcasts for mainly mostly women health and concerns, but we will also have some for men, even some adolescents. So we'll be touching on a lot of different topics. We're going to have different guests that will be joining us, from cardiologists to emergency medicine, just talking about a variety of different topics that you want to hear about or know about. So I guess let's get into the topic of the day. So we have sent out some information about menopause. This is going to be our first one that we are doing, and it's because we are both gynecologists, so we see a lot of patients and clients who are transitioning into menopause. She doesn't like to admit it, but we ourselves have been are transitioning so we can talk about it firsthand as well. May not necessarily want to talk about it firsthand, but we are experiencing some things. I probably have a fan over here, just in case I get a flash.
Silent. Because they can start early as well.
It's early for her, but it's the average age for me. But we did graduate the same year. But anyway, so listen, as we're talking about this is meant to be interactive. Type in your comments or questions that you may have. We'll try to give you topics ahead of time. So if there's things that, are pressing that you just, want to ask, and you can even type in things that you may not want to ask online, you want to ask us separately, you can do that as well. There's a comment field below, so type your questions there. We'll try to answer as many of those questions as we can get to. Tag your friend, invite them to watch, because I'm sure you all have friends like I do, Dr. White, that are going through some changes. And so we want everybody to have the information and get answers to some of the questions that they have. So future days, this is just some housekeeping. We are going to be doing these on Fridays at 2 o'clock. So it's the end of the week. People are a little bit more relaxed and not as stressed about being at work. And that is going to start November 5th. So every first Friday at 2 p.m.
Yeah.
Which is why I said sometimes we may have mimosas or something else. So join us with those mimosas or something else. But we do want this to be interactive. So we want you guys to choose a topic, send those in. Whoever we choose will actually get a prize. We don't know what the prize is going to be yet, but you will get something if we choose your topic. Dr. Clark-White, do you want to talk about the new name of the broadcast and how we're going to get that?
We have not come up with the name because we want it to be very catchy. And so we have opened it up to the audience. We're going to allow the audience to pick our name. So today and up until our next showing, which is November 1st, we will ask you guys to give us ideas or suggestions for names. And we're going to pick one of the names, and that person is going to receive a prize as well. So we want your input. What do you think we should be called?
Okay, I know you guys are very creative, and so we are excited to hear what you're going to actually want us to be called. So it will be interesting, I will say.
So you can type in names today and all the way through our next showing, which is November 1st, because we do want to have a name by then, and we'll be able to reveal that person by then.
Yes. Okay, so let's get into the topic. So we're going to be talking about menopause and perimenopause. So, the transition into menopause. Dr. Clark-White, if you want to start, you can.
So with menopause, a lot of times I'll get a patient, they come in and the patient may say, I want my hormones checked. I want to know if I'm in menopause. Well, by definition, menopause by itself, just the definition of menopause is no bleeding, no spotting for more than 12 consecutive months. And the reason we go through that is because our hormones are decreased. The hormones that are secreted from our ovaries, they're decreased, and they gradually start to decrease to where we do not have the period anymore. But we can have other symptoms associated with that, which is really what the patient is asking for. And those symptoms include it's harder to lose weight. You may have decreased libido. You may have mood swings. And that's because those same hormones that are involved in keeping us or helping us to have regular periods, they're involved in those things too. But we don't even have to check the levels to decide. We can base it on your symptoms. If you're having those symptoms, and as Dr. Terry said, the average age is about 51, and you can go in it before, which is what she was describing with perimenopause. You might just have those symptoms, but you might have irregular bleeding or what you may call regular bleeding. But it's because of the decrease in these hormones that you're experiencing these symptoms. So we don't have to check your levels, but we can definitely check your levels. And some of the hormones, they're involved in helping us sleep. So you might have problems or difficulty falling asleep, staying asleep. And so we can address those things. A lot of times the patient may want to know, well, once I go through menopause, do I have to take hormone replacement therapy? Because as we know, I think it was around 2011, the WHO study that came out, there were a lot of things concerning, does it hormone replacement therapy, is there an increased risk of breast cancer, heart disease? Well, as we know, that study it was very limited because the women involved in the study, they were older, they had medical problems that probably increased their risk of those things without the hormone replacement therapy. So for the right patient, um, I think it can be a benefit, the hormone replacement therapy. But there are a lot of other things we can do before that. What are some of the things you do, Dr. Terry?
So going back to the study as well, that study also dealt with patients who still had their uterus, and what they did discover was that people who were taking estrogen and progesterone were the ones who actually had the increased risk of and it's not a huge risk, but there is a slight increased risk for breast cancer. Those patients who did not have their uterus or they did not need to take the progesterone, I don't think that risk was increased for them. But going back to just kind of, what most of my clients and patients come in saying, a lot of it can be simply, the hot flashes are horrible and I can't focus as well. The memory is not as great. I would say, and both Dr. Clark White and I, we do, so we both write prescriptions. So I will, for the right patient, do hormone replacement, but we also do bioidentical hormones. And that's a different topic that we'll talk about probably at another podcast. But that is something, because women produce estrogen, progesterone, and also testosterone. So we both do bioidentical hormone replacement with testosterone as well. And I know from a personal experience, it does make a difference. It's not just about the libido going down. It is vaginal dryness, the mood. For me, it was mental fogginess. So if I'm talking to one of you all and I can't come up with a word, I'm probably due for my pellets. So don't judge me. Just, politely say, is it time for your pellets? Because my staff constantly remind me. I won't tell you about Dr. Clark White because
My staff remind me. In fact, my office manager just told me after this broadcast, can I get with Dr. Terry and give me my pellets? So it's time.
So testosterone is not just for men. It is for women when they're having symptoms as well, just not in the same amount of volume. But there are lots of things that I'll tell people about menopause and some of the symptoms. Like I always tell people, if your diet is horrible and you're doing a lot of processed foods, if you're doing a lot of caffeine, if you're doing spicy foods and alcohol, your hot flashes are going to be worse. Now, you can do it. Just know that the hot flashes are going to increase. Are you finding some of those same things, Dr. White?
Definitely, I am. I also tell them exercise can help because when we exercise, there are different things that are released from our brain that can help supplement where we're decreased in our hormones that are released from the ovaries. So exercise help. But when you exercise, you want to make sure you include some form of cardiovascular. And I know today it's very hard to exercise, but it does help.
Even with, because I'll tell a lot of people too, just as we start to get a little older, balance is also key. For people who are just not, runners, I mean, you don't have to, be training for a marathon, but yoga is great for balance, for tone, for strengthening. Getting 10,000 steps in, it doesn't have to be running, but that will increase. They are finding different studies where it is integral. Well, you do something for maybe like 30 seconds at a higher rate and then drop your heart rate back down. That tends to work a little bit better. And all those things help with mood. It helps with fitness. It helps with that area around the belly that starts to increase after hormones actually start to decrease with menopause. So all of those things is just about, we have to do a little bit more as we get older to maintain what we did when we were 30. None of us like it, but it is a reality. What other things, Dr. White?
The main thing is, like Dr. Terry was saying, these things, and every patient is different. So it just depends on the patient, the biggest complaint, and the complaints are not going to be the same across the board as well. So different patient may have a different complaint, and it depends on what bothers you the most and what you're willing to do and the patient. And there are a lot of different things out there. We don't have to say, oh, this is just the way it is. I'm past 50, if you're past 50. Um,
Because she's not.
but we don't have to accept it. There's so many different things out there, and we can find what's best for you, what's the right thing, and it doesn't have to be just one thing. There are just too many different things. We don't have to live like this.
What I tell people is that our 50 is not the same as our parents' 50.
Definitely.
We are much more active. We don't look like we're 50. We have more energy, and we are like, it really is very, very different. So I've had a lot of people who have said, well, I keep hearing people say, well, it's just what I'm supposed to go through. But there are a lot of things 40 years ago that weren't available then that are available now. So no, there are options. You just have to talk to your physician and kind of go through, and we'll tell you some of the things. Just if they don't bring it up, you can bring it up to ask about. But with menopause, other things that will occur is bone density starts to decrease, so your bones start to get weaker. So I always encourage people to make sure you're getting your vitamin D. If you're not getting a lot of calcium in your diet, you may have to add a supplement of calcium. We don't want you to do too much of calcium, but make sure you're adding vitamin D. More different vitamins and minerals you're going to need. What are some of the other things I tell my menopausal patients? Just
They can
making
do
sure.
the weightlifting to help with the bone density, definitely. And we actually check the vitamin D whenever we're doing the bioidentical hormones. And we find that a lot of women are even deficient in it, especially us. We don't spend a lot of time in the sun. No one really does around this time. So we can help supplement that as well. But the weightlifting does help with that too.
And not just menopausal or
Mhm.
perimenopausal. Even we're finding that my younger patients are also
Mhm.
deficient. They're not outside like they used to be. They're more in the house. They're on the video games, on their phones. So they will probably need supplementation for vitamin D as well.
Mhm.
The vaginal dryness, there are lots of different things that can be done with that. There are vaginal moisturizers that people can purchase over the counter. There is estrogen that you can actually use in the vagina to actually help with the discomfort. There are, natural hormones as well. So there's a variety of different things, but you have to talk about them. If you don't share that with your physician, they don't know. Should they ask? They should, but do everyone know? So you're a big advocate for your health. So this is just information. So if you are, so I'm going to talk a little bit about what shouldn't be occurring in a normal menopause. Now, everybody's body doesn't read the books. Um, I've had clients and patients come in. It's been 14 months since they've had a period, and then suddenly they get a period. That could happen. However, you shouldn't be bleeding every 2 weeks. The bleed shouldn't be getting significantly heavier. That's not normal. And that's when you actually need to go and have it evaluated. If you stopped having a period for 10 years and then you're having a period again, that's
It's
probably
not a
not a
period.
normal period. And you have to be evaluated, because what we want to make sure is that you don't have cancer in your uterus. And, or if you haven't been getting, let me just say, after 50 or after menopause, that does not mean that you stop seeing your gynecologist,
Yes.
because you still need pap smears, you still need breast exams, A lot of the gynecologists will even address some of the medical issues and making sure that you are preventing those things. So you still need to have follow up. If your primary care doctor is comfortable doing your exams, including your pap smear, then that's fine, but you still need to have those things evaluated. Just because you go through menopause doesn't mean that that area doesn't get touched anymore. You still have to be seen and evaluated for that.
And I can stress that more because a lot of times I'll get a patient, they come maybe 10 years after seeing a gynecologist, and they say they thought they didn't have to because they went through menopause. But definitely, you still have to come see us so we can still continue to take care of you. You still, just like Dr. Terry said, you still need that pap smear. You still need that breast exam. And if you're coming to the doctor and then you stop for 14 months with no period, but then you start, then we'll be able to help pick that up if you're not comfortable telling us. One thing I always tell my patients, I always tell them that when they come here, when we're in the exam room, this is their safe place. So I want them to feel like they can tell me anything. And a lot of them feel like they can. And I mean anything.
We're like the priest that didn't go to. We're the priest, and our office is Vegas. So whatever happens in Vegas stays in Vegas. Whatever you tell us in the office stays in the office. And we are here. The goal is to really make sure you are healthy, mentally and physically. That is truly the goal of all of this. And this is why we started doing these broadcasts, just to make sure people had the information, because information is key. So if you have questions, you don't want to put them online, you can certainly contact our office. You can do a consultation. You can leave a message. We'll get back to you. But just make sure whatever questions you have, you are asking. I think that's all I have for menopause. Oh, okay, wait. What are the early signs of menopause? You want to take it, or you want me to take it?
So the early signs, again, it depends on the patient. It depends on where you are. So you can have what's called perimenopause. Again, by definition, menopause is no bleeding, no spotting, no regular periods for more than 12 months. But before that, you can go through what's called perimenopause. You might just have irregular bleeding, where sometimes your bleeding is increased, sometimes it's normal, sometimes it's decreased. And the reason that can happen is because the secretion of the hormones from your ovary can be all over the place. And so the bleeding is all over the place. But you can have those other symptoms associated with it as well. You might start having hot flashes, but not everyone has hot flashes. You may have vaginal dryness, so you may come in complaining of pain with sex. And the reason is because of the vaginal dryness. And I get a lot of patients, they avoid sex because of the pain. Again, you do not have to live like that. You may have decreased mood. You may feel like you're more irritable. The brain fogginess that Dr. Terry was talking about. So it can be all of those things, a combination of those things. It can just be one of those things. And we can address them all with you.
And once again, everybody is different. I've had some patients who they have no symptoms. Those are the really, really lucky ones. But they may have a hot flash here or there. But I will say that if you are having irregular bleeding, now, irregular bleeding is different things to different people. If your periods are spaced apart, you don't have a period for 3 or 4 months, and then you have another one. That can happen in perimenopause. If you're bleeding every 2 weeks, that's not normal. And that's something that you actually need to see your doctor about. Because it could be something as simple as a polyp. It could be something that is abnormal. We won't know unless you actually go in to see your doctor. And if your bleeding is really heavy, you can become anemic. And that can turn into a whole different situation with affecting lots of other organs in your body. So it's okay if your periods are starting to space out further and further apart. But if they are every 2 or 3 weeks and they're a lot heavier than and it's consistently like that, you got to go in and see your doctor.
And I would say anyone that is what we call perimenopausal, any irregular bleeding or abnormal uterine bleeding, I still work up just to make sure because it's better to be safe. And there could be a lot of other things associated with that, like Dr. Terry said.
And remember, this is Breast Cancer Awareness Month. Please, 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 if you are over 40, go get your mammogram. If you are, if you have a family history of breast cancer, talk to your doctor. Depending on your age, you may need to have an earlier screening for mammograms. But please go get your mammograms.
And
We're,
you can even get them if you don't have insurance. Our office has teamed with an organization called IBCCP. So even if you don't have insurance, you can come here. You can even get a PAP, and you can definitely get a breast. I can order a breast mammogram for you.
if you guys didn't get that, we'll put it back on our site. So hi, Miss Beard. we'll put it back. She was our high school counselor. So we'll put it back on the site so you can see if you don't have insurance. There are places that you can go to get your pap smear, to get your mammograms. There's so many different resources, and people sometimes they just don't know. So we'll put that up so you can actually know where to go if you don't have insurance. I mean, these are hard times right now, and so any little thing will help.
Hi, Shalandra.
Okay. Any more questions? Okay, Lisa, you're in the running.
I like it.
So listen, guys, send in those suggestions for what we should call our new health and awareness podcast, broadcast, whatever we're calling it. The next one is going to be November 5th. Then it will be December 3rd, but it will be the first Friday every month at 2 p.m. So after the full work week, we can kind of sit down, relax, and actually have a little fun, but also talk about things that are important to your health.
So in addition to sending in different topics, maybe send us some ideas of who you would like to see on our show, because we're going to invite different people on the show, different things that you want to see us do. Within reason.
Remember, this is a family-friendly show. Thank you, Tamiko. She says she loves the chemistry between. We've been together for a long time. There's actually one more person who, and she'll be on the show. We're gonna force her to do it, but this is about information and making sure we get the word out. Questions are always welcome. We want to make sure that whatever questions you have, please send those in. For the next week or so, if you have topics that you want to discuss, send it in, and then we will be able to choose one of those topics for our next talk on November the 5th. So I will just reiterate. Dr. Clark-White will reiterate and we'll put it back on the screen where her location is and her office.
I am in the South Loop area, 1935 South Wabash. Telephone number is listed, 312-526-3807. Again, I have teamed up with an organization, even if you don't have insurance, just to make sure you're okay. I do offer free PAPs and free breast exams and ordering free mammograms to help assist you.
And I am Dr. Tony Scott Terry, and my medical office is located. Currently, we are at, where am I? I need my pellets. 20325 South Graceland Lane, Suite B. We're in Frankfort, Illinois. The phone number there is 708-895-8497. So give us a call. Make sure you don't have to see us, but go see someone, especially if you're having any concerns that we've kind of addressed today. Hi, Dimple Queen. Thank you. That was sweet. So come up with some of those names so we can announce it at our next taping, and then we'll see you guys soon. Okay.
Thank you for tuning in.
Thanks, you guys. Bye bye.
Bye.